So we had a very interesting session in which we had 4 people talk about mesothelioma, which is an orphan disease that is asbestos associated and over the next 50 years will take 300,000 lives across the world. And what we discussed today were the use of novel biomarkers and the studies to try and detect the disease earlier, as well as some of the newer findings with regard to asbestos carcinogenesis, why asbestos actually causes cells that line cavities to become malignant. So the biomarkers that I've been particularly interested in include 2. One is called SMRP, soluble mesothelin-related peptide, and it's a relation to mesothelin. Mesothelin is a protein that's associated with mesothelioma. It's seen in a few pancreatic cancers as well as in lung cancer, but was found to be elevated in the serum of patients who have mesothelioma compared to patients who have exposure to asbestos. Those were original findings that were published by Dr. Bruce Robinson. We validated that in the United States and also have recently finished a large 800 serum validation trial that was a blinded validation trial that showed that SMRP indeed is a very robust marker. We also have another marker that's called osteopontin. Osteopontin was detected using genomic investigations and found to be elevated in patients who have mesothelioma, and indeed it was found to be elevated in the serum and the plasma of individuals with mesothelioma. That also validated on that 800 international validation trial. Finally, the newest data is that in a cohort of individuals from a study called the CARROT study, which was a chemoprevention study in which asbestos-exposed individuals were followed for a period of about 10 to 20 years, 49 mesotheliomas developed in that population. Sera had been banked on all of those patients. So when we were given access to those sera, we were able to show that SMRP could predict the development of mesothelioma with an area under the curve, which was pretty good, of about 0.7 for that single marker in a blinded fashion. So that marker now, SMRP, is moving on to studies in an epidemic of mesothelioma in Cappadocia, Turkey, where 50% of the villagers there develop mesothelioma. And we're hoping that the SMRP will be able to tell us who's actually developing the tumor. And so it's very important that these be validated in a prospective fashion before they are uniformly used around the world. Because if you find an elevated marker, that has big implications. I mean, are you going to have to do a CT scan? Are you going to have to do a PET scan? If you have an abnormality, are you going to biopsy? So you have to be pretty sure about the sensitivity and specificity of these markers before they're turned over for general use. So in a stepwise fashion through our studies for the Early Detection Research Network in the United States, we're doing it in that way to try and validate the marker. If you did the test and it was elevated but didn't have mesothelioma, so in other words, you're following the patient, then what you would do is you would have that patient, if they worked in an asbestos environment, then you would follow the patient with the marker every 3 to 6 months, one blood draw instead of all sorts of CTs that may not pick it up. Every 3 to 6 months, if you then saw an elevation of the marker, that would be the signal to then do the workup to make sure the patient's not developing a mesothelioma. Our feeling is that mesothelioma detected early has much better treatment options with regard to surgery or multimodality therapies than if it's detected late. And presently, only 8% of all the mesotheliomas are detected in stage 1. So that's a very humbling number. So we'd like to increase that number so those patients could be treated effectively. The latency period can be anywhere from 15 to 40 years, usually about 25 years. And many of the westernized countries have decreased the use of asbestos. But still, there will be a period of time before the people who were exposed will develop their mesotheliomas. And indeed, maybe the number of mesotheliomas after 2050 will go down. But that's in the westernized civilizations that we know of, the United Kingdom, the United States, Australia, the Netherlands. What about places like Russia or China, where we don't have asbestos abatement, or we don't know what the laws have been to try to prevent asbestos exposure? So the development of these tools now may help in the future to help those patients in third world countries.